Hey everyone, and welcome to a deep dive today, all about prediction in medicine. We're going to be talking about diagnostic and prognostic research.
Okay.
And our guide for this journey is episode 10 of Significant Talks by Dr. Hamdi Alhakimi.
Very cool.
So it's all about kind of like figuring out what's happening right now versus what might happen down the road.
Yeah, that's a great way to put it. It's like having these two different lenses to look at a patient's health. One lens helps us pinpoint what's going on at this very moment,
Right.
like right now. Do they have the flu or not?
Exactly.
And the other lens helps us kind of gaze into the future
Yeah.
and assess the likelihood of something happening down the line, like will they develop heart disease?
So both sound super important for making good decisions about a patient's care.
Absolutely.
But I'm curious, how do these two types of research actually differ in practice?
Right.
Dr. Alhakimi mentioned something about different study designs.
Yeah, you've hit on a key distinction there. So diagnostic research typically relies on cross-sectional studies, which are like taking a snapshot of a group of people at a specific point in time.
Okay.
It's like a survey,
Yeah.
where you gather information from a sample of individuals to understand the prevalence of a certain condition at that moment.
So it's like capturing a moment in time.
Exactly.
What about prognostic research?
Yeah.
How does that approach things differently?
Prognostic research usually uses cohort studies
Okay.
where you follow a group of people over a period of time to see how things unfold.
Got it.
So this allows researchers to observe how different factors like lifestyle choices
Uh-huh.
or genetic predispositions influence the likelihood of developing a particular condition or experiencing a certain outcome.
So it's less like a snapshot and more like watching a movie unfold.
Yeah, that's a great analogy.
Okay, cool. That makes sense.
Yeah.
But I imagine building these predictive models, whether we're talking about diagnostic or prognostic,
Right.
it must be a pretty complex process.
It can be.
What are some of the key ingredients that go into creating these models?
Well, it does involve some statistical wizardry,
Okay.
but the core idea is actually pretty straightforward.
Okay.
It's all about identifying factors that are strongly associated with the outcome we're interested in predicting.
Okay.
And these factors are often called predictors.
Predictors.
Yeah. And they could be things like age, blood pressure, lifestyle habits, or even genetic markers.
So like finding those telltale clues that hint at what might happen?
Exactly.
I imagine it's not just about finding any old correlation, though.
You're right. It's not just about correlation. It's about finding factors that have a strong and consistent association with the outcome. And to do that, researchers rely on statistical techniques like regression analysis.
Okay, regression analysis.
Yeah.
That rings a bell from like stats class.
Yeah.
Maybe you could give us a quick refresher.
Sure. So imagine you're trying to predict someone's blood pressure based on their age.
Okay.
You could plot those two variables on a graph with age on the x-axis and blood pressure on the y-axis.
Okay.
Regression analysis helps you find the line that best fits the data points, showing the general trend of how blood pressure changes with age.
So it's like drawing that line of best fit through a scatter plot,
Exactly.
showing the overall relationship.
Yeah.
And the slope of that line would tell you how much blood pressure is expected to change for every year increase in age.
That's exactly right.
Okay.
And in the context of predictive models, regression analysis helps us determine which factors have the strongest influence on the outcome we're trying to predict,
Gotcha.
allowing us to build a model that can estimate the likelihood of that outcome based on those factors.
Okay, so we've got our predictors. We figured out which ones matter most using regression analysis.
Right.
We've built our model. But how do we know if it's any good?
That's where things get even more interesting. We need to put our model to the test.
Okay.
See how well it performs in predicting the outcome of interest.
Right.
And there are two key aspects to consider: calibration and discrimination.
Okay. Calibration and discrimination.
Yeah,
Those sound pretty important.
they are.
Let's start with calibration.
Okay.
What does that mean in the context of these models?
Calibration is all about checking how well the model's predicted probabilities match the actual observed frequencies.
Okay.
In other words, if our model predicts that someone has a 70% chance of developing heart disease,
Uh-huh.
does that prediction line up with what we actually observe in the real world?
So it's like checking if the model's predictions are aligned with reality.
Exactly.
If our model is consistently overestimating or underestimating the risk, then we know something's off.
Exactly. And there are different ways to assess calibration, but one common approach is to use a calibration plot.
Okay.
This plot visually shows how all the model's predicted probabilities correspond to the observed frequencies.
I'm a visual learner, so that sounds helpful.
Yeah.
What would a good calibration plot look like?
Ideally, the points on the calibration plot would fall close to a diagonal line, indicating that the model's predictions are well calibrated and accurately reflect the true probabilities. If the points deviate significantly from that diagonal line, it suggests that the model might be overestimating or underestimating the risk.
Gotcha. So we've got calibration, which is all about making sure our model's predictions are accurate and reliable.
Right.
What about discrimination? How does that come into play?
Discrimination is all about the model's ability to distinguish between those who will experience the outcome and those who won't.
Okay.
It's like having a good eye for spotting the subtle differences that separate those two groups.
So a model with good discrimination would be able to accurately identify those who are truly at risk,
Right.
while a model with poor discrimination might lump everyone together
Yeah,
or miss those who are actually at high risk.
precisely. And to measure discrimination, we use two key concepts: sensitivity and specificity.
Okay.
Sensitivity is the model's ability to correctly identify true positives, meaning those who will actually experience the outcome. Specificity, on the other hand, is the model's ability to correctly identify true negatives, meaning those who won't experience the outcome.
Okay, so high sensitivity means the model is good at catching those who are truly at risk.
Yeah,
And high specificity means it's good at ruling out those who aren't.
exactly.
But isn't there a potential for overlap there? Couldn't a model be really good at identifying true positives, but also end up flagging a lot of false positives?
That's a great observation. There's often a trade-off between sensitivity and specificity.
Yeah,
And that's where the ROC curve comes in.
ROC curve.
Yeah.
That sounds familiar, but I can't quite place it.
ROC stands for Receiver Operating Characteristic Curve.
Okay.
And it's a powerful tool for visualizing the trade-off between sensitivity and specificity across different thresholds.
Okay, bear with me here. Thresholds. What do thresholds have to do with this?
Imagine you're using a model to predict the risk of a heart attack.
Okay.
You could set a threshold where anyone with a predicted risk above 50% is considered high risk, but you could also set that threshold higher or lower.
Right.
The ROC curve helps you see how changing that threshold affects the balance between correctly identifying true positives, sensitivity, and correctly identifying true negatives, specificity.
So it's like a sliding scale that helps doctors fine-tune the model's performance based on the specific situation.
Precisely. And the area under that ROC curve, called the AUC,
Okay.
gives you a single number that summarizes the model's overall discriminatory power.
Gotcha.
A higher AUC means better discrimination, with an AUC of 1 representing perfect discrimination, meaning the model can perfectly separate those who will experience the outcome from those who won't.
Wow, that AUC sounds like a pretty handy metric.
It is. It's one of the most commonly reported measures of model performance in diagnostic and prognostic research.
This has been incredibly insightful.
So good. But
We've covered a lot of ground already, from defining diagnostic and prognostic research to understanding how these models are built and assessed for accuracy and discrimination.
yeah.
But I'm eager to hear more about how these concepts play out in real-world clinical scenarios. Dr. Alhakimi mentioned some fascinating examples in his talk. Should we dive into those next?
Absolutely. Let's explore how these models are making a real difference in patient care.
Awesome.
Yeah. So one example that always comes to mind is the Apgar score.
Go.
It's a really simple but elegant tool used to assess newborn babies right after they're born.
Ah, yes, the Apgar score. I remember hearing about that. But I could definitely use a refresher. What exactly does it involve?
So it's based on 5 key factors: appearance, pulse, grimace, activity, and respiration.
Okay.
Each of these factors is scored from 0 to 2, with a total score ranging from 0 to 10.
Okay.
So it's kind of like a quick checklist that doctors can use to get a sense of the baby's overall health and well-being right from the get-go.
Got it. So a higher score means a healthier baby, right?
Exactly.
What happens if a baby scores low on the APGR?
So a score of 7 to 10 is generally considered normal, indicating a healthy baby with good vital signs.
Okay.
If a baby scores lower, it might suggest that they need a little extra help, like some oxygen or suctioning. And a score of 3 or lower is a signal for immediate medical attention.
Wow. So this simple score can literally guide life-saving decisions.
Absolutely.
That's amazing. And what makes this a good example of a predictive model?
Because it's not just about assessing the baby's current state.
Right.
It's also about predicting how they'll do in the next few minutes and hours.
Okay.
A low APGR score can alert doctors to potential problems down the line, allowing them to intervene early and hopefully prevent complications.
I see. So it's not just a snapshot, it's also a glimpse into the future. That's really powerful. Are there any other examples from Dr. Alhakimi's talk that illustrate how these models are being used in practice?
Absolutely. He also talked about the D-dimer test,
Okay.
which is a blood test that helps doctors rule out deep vein thrombosis, or DVT.
DBT. Those are the blood clots that can form in the legs, right?
That's right.
I've heard those can be pretty dangerous if they travel to the lungs.
You're exactly right. A pulmonary embolism, which is what happens when a blood clot travels from the legs to the lungs, can be life-threatening. So it's really crucial to identify and treat DVT early on.
And how does the D-dimer test help with that?
So D-dimer is a protein fragment that's released into the bloodstream when a blood clot breaks down.
Okay.
So if someone has elevated D-dimer levels, it could be a sign that they have a clot somewhere in their body.
So it's like a smoke detector for blood clots.
That's a great analogy.
If the D-dimer alarm goes off, it's a signal to investigate further.
Exactly. The D-dimer test is especially helpful in primary care settings,
Okay.
where doctors need a quick and reliable way to rule out DVT in patients who come in with symptoms like leg pain or swelling.
So it helps doctors avoid unnecessary tests and procedures,
Exactly.
which is good for both patients and the healthcare system as a whole.
Absolutely. It's all about using the best available evidence to guide clinical decisions and ensure that patients receive the most appropriate care.
These real-world examples are really bringing this whole concept to life. Are there any other examples we should touch on?
Yeah, one more that comes to mind is NT-proBNP, which is a biomarker that's used to help diagnose and manage heart failure.
Heart failure. That's a serious condition.
Yeah.
How does this biomarker come into play?
NT-proBNP stands for N-terminal pro-brain natriuretic peptide.
Okay.
It's a substance that's released by the heart when it's under stress, like in heart failure.
So if someone's heart is struggling, their NT-proBNP levels will be elevated.
Right.
And that can help doctors confirm a diagnosis of heart failure.
That's right. But it's not just about diagnosis.
Yep.
NT-proBNP can also help doctors assess the severity of heart failure and predict how well a patient might respond to treatment.
So it's a valuable tool for guiding treatment decisions and monitoring patients over time. It's like having an extra set of eyes on the heart,
Yeah.
helping doctors make more informed choices.
Precisely. And this highlights the real power of these predictive models.
Mhm.
They're not just theoretical concepts. They're tools that are being used every day to improve patient care and outcomes.
This has been incredibly fascinating. We've gone from the basics of diagnostic and prognostic research to real-world examples of how these models are being used to make a difference in people's lives. What else can you tell us about how this field is evolving?
Yeah, it feels like we've only just scratched the surface here.
How did that?
What are some of the areas where you see diagnostic and prognostic research having the biggest impact in the future?
That's a great question. One area that's particularly exciting is oncology.
Oh?
Predictive models are already playing such a crucial role in guiding treatment decisions for cancer patients. And we're only going to see that role expand in the years to come.
Yeah, that makes sense. Cancer is such a complex disease
It is.
with so many different factors at play.
Absolutely.
How are these models helping doctors kind of navigate all of those complexities?
So these models can actually help doctors determine which therapies are most likely to be effective
Okay.
based on a patient's individual tumor characteristics and genetic profile.
It's all about moving towards more personalized and targeted treatments.
So instead of a one-size-fits-all approach,
Right.
it's about tailoring treatment to each patient's unique situation.
Exactly.
That sounds incredibly promising.
It is.
Are there any other ways these models are being used in oncology?
Yeah, another really important application is in predicting cancer recurrence risk.
Okay.
So by identifying patients who are at higher risk of relapse,
Right.
doctors can intervene earlier with more aggressive monitoring or follow-up care,
Go.
potentially improving outcomes.
So it's like having an early warning system
Exactly.
that allows doctors to be more proactive and vigilant. That's incredible.
It is.
And are these models being used in other areas of medicine besides oncology?
Oh, absolutely. Cardiology is another field where predictive models are making a big difference.
Okay.
For example, there are models being developed to predict the risk of heart attacks or strokes,
Wow.
helping doctors identify individuals who might benefit from preventative measures like lifestyle changes or medication.
It's fascinating to see how these models can be applied to such a wide range of conditions.
Yeah, it's really cool.
What other areas are you particularly excited about?
Infectious disease is another area where these models are proving to be invaluable.
Okay.
They can be used to track and predict the spread of infectious diseases, helping public health officials make informed decisions about things like resource allocation, vaccination campaigns, and other interventions to try to contain outbreaks.
So they're not just about individual patients, but about populations as a whole.
Exactly.
That's really powerful.
It is. And it highlights the importance of collaboration and data sharing in this field.
Yeah.
The more data we have, the better our models will be.
Yeah.
And by working together, we can develop more accurate and robust models that can benefit people all over the world.
This deep dive has been eye-opening.
I'm glad to hear that.
We've covered so much ground, from the nuts and bolts of model building to the far-reaching implications for patient care and public health.
Right.
Any final thoughts you'd like to share with our listeners?
I think the main takeaway here is that this is a field that's constantly evolving.
Right.
And the future is just brimming with possibilities, as technology advances and our understanding of disease processes grows. We can expect even more sophisticated and impactful predictive models to emerge.
Right.
And those are really going to shape the future of healthcare in profound ways.
It's exciting to think about the potential for these models to really improve people's lives.
It is.
Well, thanks so much for joining us on this journey into the world of diagnostic and prognostic research.
It's been my pleasure.
We hope you found it as enlightening as we have. Until next time, stay curious.